Hi, today I'm going to review my soap note with you, and it is on hypothyroidism for week 2. I have a 65-year-old Caucasian female who was born 1956, is a reliable source, and has private health insurance. Her chief complaint was feeling tired and sleeping poorly. She is coming in to review her thyroid studies also, which were abnormal. She is complaining of fatigue, weight gain of 15 pounds over the last 2 months, and trouble sleeping, stating that she gets about 5 hours of sleep per night and wakes up tired every morning. She is taking Synthroid, 150 mics by mouth per day, and reports taking it on an empty stomach first thing in the morning. Past medical history included hypothyroidism, hypertension, vertigo, and she did test positive for COVID earlier during the year. She does not have any past surgical history. Her medications include enalapril with hydrochlorothiazide together, doses 10/25 milligrams per day. She's also on Lexapro, 10 milligrams per day, potassium chloride, 10 milliequivalents per day, and Synthroid, like I said, 150 mics per day on an empty stomach. She does not have any allergies to food, environmental, or drugs. Her family history, there was no significant family history for endocrine problems or thyroid problems, although her father did have a history of cancer, and her mother and brother have hypertension, CAD. Socially, she has denied any alcohol or tobacco use, was a secretary, is retired now, and exercise and diet. She does not really get any regular exercise per week. She does follow low-fat cholesterol diet, though, and does report some stress, increased stress, recent in her life due to changes in her living arrangements going on. And with that, lack of motivation to do her hobbies and some depression was voiced. Immunizations are up to date for her also. Review of systems, constitutionally, she denies any fever. She does report a decrease in her appetite and the weight gain of 15 pounds in the last 2 months. She also has reported some headaches and fatigue, lots of stress with some depression. Cardiovascularly, she denies any shortness of breath, palpitations, heart murmurs, or racing in her chest. Respiratory, she does not have any problems with asthma, bronchitis, pneumonia, or problems sleeping flat at night, or any history of sleep apnea. She did report some coughing, dry cough, and some shortness of breath with exertion. GI-wise, she denies any trouble swallowing, any problems with diarrhea, constipation, or nausea. Bowel movements were regular for her daily and no abdominal pain. GU, she has no complaints of incontinence or dysuria. Musculoskeletal, she did report some stiffness in her joints, but she does have full range of motion. No problems with broken bones or osteoporosis was reported. Neuro, she did not have any complaints of seizures, dizziness, vertigo, weakness, or numbness, paralysis, or tremors. Endocrine-wise, she did have some weight gain, heat intolerance, and night sweats. And hematologically, she reported no problems with frequent infections or bruising, rashes, or lymph gland problems, swelling. So her objective assessment involves starting with her blood pressure, pulse 64, blood pressure 120 over 74, respirations were 20, her temperature was 98 degrees, and no pain was reported. Her height is 60 inches, her weight was 77.2 kilograms, her BMI was 45. Physical exam, general survey, she looks relaxed, she's neatly groomed, oriented and alert, well-nourished, no acute distress. She does complain of some malaise, fatigue, no tremors or restlessness was noted. Her head, her hair, soft distribution is normal. Facial attributes are symmetrical, and there's no tenderness to her scalp. Lymph nodes were not palpable. Her eyes, uh, pupils will equally react round and reactive to light. Normal accommodation. Conjugate gaze was normal, and no nystagmus was noted. No periorbital edema also was noted. Peripheral vision was intact as well. Neck, supple, no stiffness. Trachea is midline, no thyroid megaly, and her lymph nodes were not palpable. Her mouth, mucous membranes orally were intact and pink. Her dentation was normal and intact. Uvula was midline, and her vocalization, there was no change in her voice or hoarseness noted. Heart tones, S1, S2, with regular rhythm and rate. No murmurs, no gallops, no carotid buries or JVD. No peripheral edema was also noted. Respiratory breathing was regular, easy effort. Breath sounds were not diminished. They were equal. Chest excursion was symmetrical with inhalation and exhalation. No problems. GI wise, her abdomen is non-distended, soft, and non-tender. And normal active bowel sounds. No hepatomegaly or splenomegaly was noted. Her skin was intact also without any lesions. There was no jaundice, no dry flaky skin noted. Neurologically, she was intact, awake, alert, oriented ×4, cooperative, no tremors, no focal deficits were picked up. Cranial nerves 2 through 12 were intact, did not test 1. Negative, Kernick sign, Burdinsky sign, no nuchal rigidity. Musculoskeletal wise, her muscle bulk and tone was intact. Strength was 5 out of 5 bilaterally. Rapid alternating movements were intact. Also, gait was normal with base. No positive pronator drift or Romberg tests. And her deep tendon reflexes were normal. So her assessment, we looked at her TSH. It was 0.016, which is low. Her T4 level was 2.2, and her T3 level was 4.0, which were both normal. So my differential diagnosis, I picked sleep disorder due to reports of fatigue, anxiety, problems sleeping, averaging 5 hours of sleep a night. The second differential was subclinical hyperthyroidism due to her TSH level of 0.014, which is low. BMI of 45, gaining weight, rapid reports of anxiety, nervousness, and insomnia, and increased stress. The last differential was obesity due to her BMI, 45, complaints of fatigue, insomnia, anxiety, and gaining weight, 15 pounds over the last 2 months. The primary diagnosis was subclinical hyperthyroidism, which was due to her TSH level being 0.01, and BMI of 45, gaining weight. Reports of anxiety, nervousness, and was also evidenced. The diagnostic studies that we did order was a CBC to rule out anemia and infections, chemistry to look at her fluid and electrolyte balance and assess her renal function, and an EKG to rule out any dysrhythmias. Specifically, we were looking for evidence of AFib, which can occur with hyperthyroidism. And then we also referred her for a DEXA scan to rule out bone loss, osteopenia, and osteoporosis with elevated or over supplementation with thyroid hormones. You can cause long-term damage to bones. So the treatment involved decreasing her synthroid to 137 mics per day, which we can give 1 tablet per day. Educate her about the signs and symptoms related to hyperthyroidism, which she has an elevated level of thyroid hormone circulating due to over replacement. So those include tachycardia, palpitations, chest pain, shortness of breath, feeling of depression, memory changes, brain fog, vision changes, bowel symptoms. We gave her a handout that went over specific symptoms to be aware of and to monitor for. And her follow-up was for 4 weeks to reassess her TSH level and T4 levels. until she is euthyroid, in a euthyroid state. We would reassess her at least every 4 weeks, until she gets to her normal level. And that's it. Thank you.